Well, I see you're through talking. Are you ready for some further instruction before you make your choice? Very good. One of the skills you'll have to learn here in the backcountry is how to work with surgical tools. Now, there are many surgical tools. I placed a few of them on the table, and I want you just to get a sense for how much work you're going to have to be doing. We have several saws. The saws, of course, will be used for amputation, because there are many important wounds and things that will happen to you that we cannot help you with, and we're going to have to help the patients by actually removing arms and legs and limbs. So you have to be using your surgical saws. Oftentimes my young students ask me about how we handle the bleeding. These tools are used for cauterizing. With these tools we will be putting them into the flames, and you'll be assisting me by handing me the handles so I can work with that. What if one gets a bullet wound in one of your patients? I often use this tool. This is just like the tool that your fathers might use in removing lead balls from guns loaded properly in the breech. But we'll use this and go through the wound, and I will teach you how to find the ball, how to insert this, and how to remove the lead. Very important that we get those lead pieces out. This is your capital surgical knife. You'll be trained in the use of this knife and how to make quick incisions. We can only take 2 or 3 minutes on an amputation. We must do it as quickly as possible, and I will teach you how to use this tool. Another tool that we often use is something called a trapening. If a person gets a closed head injury, we will apply this to the skull and twist it until we remove a little piece of the skull bone. And after the brain expands through the hole, eventually we close it up by putting in a coin, flattening the coin, putting little screws in. And I'll get you so you're very good at doing that, because unfortunately we have many of that kind of wound. You'll be studying your suturing techniques. Notice the curved needles. This is to make it easy to go in and out as you suture. And we'll have lots of practice with these. There's no end to people working with chopping wood and having to have these used on them. Another important technique we use is something called bleeding. This originally was used for people shaving, but it fits many parts of the body. And I will teach you how to properly make the cuts in the veins and how to draw the blood off, because we're dealing with balance, and we want to make sure people's bodies are in balance by taking away what is wrong. And we'll have lots of practice with bloodletting. One of the other problems we have is sometimes too much blood is leaving the body. So I have a tourniquet. You can see how that's used. I'll teach you how to properly put the tourniquet on, how to tighten, loosen the pressure to help with the wound. You get lots of practice with this. I often have my apprentices within the 2nd year assisting me with the surgery. Now, with that having been said, talk about it some more, and possibly you want to have more questions for me in a little while. I'll be busy here. Take your time.